I began noticing a change in my hair when I was very young. When I was in my late teens, I noticed the beginning of a slow, gradual thinning of my hair.
I had thinning a little bit in the front and in the back around the crown area.
I think after I had my kids, I started noticing that I was really losing a lot of hair.
People don't want to see you looking unhealthy. And my concern was when I was looking at my scalp and my overall face, it just didn't seem I was looking very healthy. So I was just trying to find out if there was something I can do about it.
Well, trichology is actually the scientific study of hair loss and scalp disorders.
Hair loss can be very devastating, particularly for women. For men, in a lot of cases, a guy, we can shave our head off and all of a sudden we're sexy. But when it comes to women, it definitely affects their self-esteem, their morale, as well as their self-confidence.
There was a little bit of maybe a denial that I was losing my hair, which I think a lot of people go through.
Everything is gauged on sort of how your hair looks, bad hair day, good hair day, and it seemed like I always had a bad hair day.
My father is completely bald right now. He has a little bit of hair around the side, so I guess it was inevitable that one of my siblings, or including myself, would end up going bald eventually.
It was very easy. I just went online and I booked my free consultation, and I might have even gone the next day.
Well, it starts with the consultation. We want to make sure we look at everything from diet to lifestyle.
I know I was immediately struck by how calming and therapeutic the clinic was. You know, for the first time I didn't feel like I was being judged or being turned away.
We do a full scope analysis so we can make sure there is hair there to grow.
And we'll look at the hair as well as the scalp under a microscope. We'll also look under the polarized microscope at the actual root of the hair. We look at the cuticle of the hair, which is the outermost portion of the hair. And also we look at the scalp, because your hair grows out of your scalp.
It was such a relief after talking to the trichologist. It really gave me a lot of hope that I wouldn't have to suffer with my hair loss.
He explained everything, showed me some visuals, explained why I was probably affected, and really encouraged me to keep trying the treatment and also to give it every effort. He said, if you stick with it and you're faithful, it will work, and it did.
They try to create a very custom, personalized treatment for you. So they'll ask you, what have you been doing on your own for your health? What kind of vitamins, what kind of shampoos you use? More or less trying to find out a holistic approach to how they can treat you.
Our key component here is the low-level laser.
The laser therapy is biostimulating. It sends blood flow to the follicle as well as restores the overall hair shaft. So it's very, very effective.
I did the laser therapy for about 6 months.
The treatment is not painful at all. It's actually very relaxing. You get to come in during your entire duration of your 30-minute laser session. You can relax, listen to music, take care of information on your phone, read magazines.
It's a very painless process. You come in a couple of times a week. If people can abide by that and do the treatment that they prescribe, I think they'll get very good results.
I came in, I think, twice a week for 20 minutes. And I was given a special type of shampoo and conditioner that was really gentle and nourishing on my hair.
But I did start to notice significant differences in my hair as it relates to thickness and fullness. After
4 months, which is the typical length of the treatment period for people, looking at my before and after pictures, or just the before pictures and looking at myself in the mirror, it was like night and day.
For me, I started seeing results around 4.5 to 5 months into it.
A lifelong friend said to me, okay, I have to ask you, your hair looks so much better. It looks really good. Are you doing something different with your hair? And so I was able to tell her, yes, I'm getting some laser treatments.
Yes, it's very cost effective. I mean, you could do a hair transplant, which is considerably a lot more expensive. So as far as time management and cost goes, it's a bit more cost effective.
You have to set aside a little bit of money. It's not anything extremely expensive, but it's definitely worth it because it's a one-time treatment process. It's not like you have to do this every year, every 5 years. It's a one and done as long as you maintain the regular routine maintenance that you're supposed to.
You know, what really makes us happy is at the end of the day, when we spend the time with our patients and our clientele and they come back to us and we do the before pictures and we do the after pictures, and they look at us and almost literally tears of joy, and just the time that we spent with them, and to see their hair grow and to help their confidence and just, you know, be able to help them along the way. That really just brings you the best satisfaction.